myself, Dr. Manna Lal Bhansali. I am practicing internal medicine for more than 40 years in Howrah, and we are seeing lot of cases of hypertension. In India, incidence of hypertension is 15 to 20% in adult population, and half of these patients, they are never diagnosed. And out of those half who are diagnosed, only 50% are taking treatment, and those who are taking treatment, only 50% are achieving target blood pressure, that is below 140/90, or sometimes our target is, if there are comorbidities like kidney disease or heart disease, then our target becomes 130/80. So only 10 to 15% patients are being treated up to target. And because we know that hypertension is a cause for coronary artery disease, that is heart disease, for brain stroke, and for kidney disease, as well as for peripheral artery disease. So if it is not treated, it is a silent killer. It will damage your heart, your brain, your kidneys, and as it is a lifelong disease, so one has to take treatment for lifelong. So for treatment of hypertension, our lifestyle should be modified. We should take salt in moderation, that is 6 grams common salt per day, not more than that, because if we take excessive salt, then control of blood pressure will become difficult. One should avoid fatty and fried food, because fried food contain a lot of trans fatty acid, and these trans fatty acids are reason to cause coronary artery disease. So one should avoid fatty food, fried food, excessive salted things like bhujia, papad, kachori, pakodi, samosa. All these are containing lot of salt and lot of trans fat. And one should take regularly, that is fruits, salad, green vegetables, dal, that should be taken. And regular physical exercise is a must, because by regular physical exercise, our cholesterol will be reduced, our blood pressure will be reduced, our weight will be controlled. And it is told that if we can reduce body weight by 1 kg, there is 1 millimeter reduction in blood pressure. So if one is obese, if he can reduce body weight by 10 kg, then 10 millimeter of mercury will be reduced in systolic and 5 millimeter in diastolic. And regarding other foods, one should avoid excessive sugar, that is sugar containing fruit juice, colas, excessive sweets or ice cream, that must be avoided, because that will lead to increase in body weight. One should do regular physical exercise, and along with that, smoking should be stopped. In India, apart from smoking, there is people are taking khani, gutka, jarda, so all type of tobacco, that should be avoided, because tobacco will increase incidence of atherosclerosis. It will cause high blood pressure, and it is bad for many types of. It is notorious to cause many types of cancer also. So smoking, one can get lung cancer also, and by chewing gutka and canny, one can get oral cancer. So these all should be avoided. Cut down on alcohol. Alcohol should be limited to less than 1 drink a day for women, and less than 2 drinks a day for man. One should not encourage alcohol intake, but this much can be one can take. But those who are not taking, they should not be encouraged to take alcohol, because it is not a medicine. Get good night's sleep. Poor sleep quality will be detrimental for blood pressure control, because if one is not sleeping properly, his daytime blood pressure will be increased. And one should take regular relaxation. Anxiety, nervousness, and depression, emotional stress, they all cause high blood pressure, so they should be avoided. And one more factor about obesity is that sleep apnea syndrome. Many of the obese patients, you can see that nighttime there is sleep is disturbed, and In daytime there is excessive sleepiness. So they should reduce body weight, and they should take appropriate treatment for sleep apnea syndrome to control their blood pressure. So apart from lifestyle measures, one should consult his or her physician and take medicines regularly as prescribed, because uh, this is a chronic disease. It is a lifelong disease, hypertension. So lifestyle measures and drugs, if required, should be taken lifelong to avoid complications of heart, kidney, and brain. So one should remain healthy by doing uh, lifestyle measures and by taking regular medication. Thank you.